stress response and what that can do to your blood sugar. Sometimes the questions when we ask patients in the office, and you should ask yourself, are, when do I feel fatigue the most? Do I feel fatigue after meals? Do I feel fatigue between meals? We're all familiar with that Thanksgiving syndrome where we fall asleep after we eat and pass out on the couch. Well, actually that's not normal, and I want to show you kind of how that works, and maybe you can figure out where you sit in the fatigue aspect with blood sugar. So I want to mention that, when there's a stress on the body, and this can be mental, emotional, chemical, physical, infections in the body, nutrient deficiencies, mental, emotional stress, not sleeping is a big one. Well, that's going to affect the adrenal glands. And I think we've all heard of the adrenal glands, and we're familiar with the adrenal glands. And they deal with kind of controlling your stress hormone and how you respond to that. So when there's a stress in the body, you activate these adrenal glands, and there's two scenarios. You've heard of probably adrenal fatigue and adrenal activation, or I call it adrenal stress. So basically, on one side, you're increasing the adrenal stress, you're overactivating the adrenal response, and on the other side, you're causing more of an adrenal fatigue, where the stress has been going on for so long that that adrenal function, or your stress hormone function, kind of goes downhill. So two scenarios. So what happens in each? So when there's stress to the adrenal glands, you get an adrenal fatigue scenario, and what happens is you have less adrenal hormone output. So there's less of your stress hormone, which is cortisol. You have less hormone output. And when there's less hormone output, what happens is you can't break down sugar effectively in the diet. And when you can't break down sugar effectively in the diet, you start to get low sugar, if that makes sense. You're not getting enough energy into the cell tissue, so therefore what happens is you're going to get fatigue after when you eat, or between meals, I'm sorry. You get fatigue between the meals because you're not breaking down those nutrients in between the meals to therefore get you the energy that you need. Well, on the flip side of that, if you have increased adrenal gland production, so you have increased stress hormone and cortisol, what happens is you're going to increase how fast you break down blood sugar, or you'll break down sugar quicker. And when that happens, you get too much in the bloodstream. And when that happens, you start to become insulin resistant. It's almost like herding cattle. You can only do one at a time, but you've got 50 behind you. So you become resistant, meaning your body starts to kind of shut down because it can't utilize the sugar effectively. And when you can't utilize the sugar effectively, you start to get fatigue after meals, because like I said, you have all that sugar waiting to get through the gate, but because of that, your body being resistant to it, you're not getting enough in to get you the energy. So when you eat right away, you're not getting the nutrients you need. And that becomes insulin resistant, which means you're now going to store sugar as fat versus use it for energy. And so when you have these stresses in the body, you can affect how your body utilizes sugar, therefore utilizes metabolism, or how it metabolizes, so therefore breaking down fat, losing weight, even creating energy. So if you have fatigue after meals or even fatigue between meals, that is clearly a blood sugar problem. And when you have that problem, I think that is a huge stress on the body, which is a stress to your adrenal gland production. So most people think, I can go a long time without eating, or it's not a big deal, or I get that funny, after Thanksgiving I gotta lay down and sleep it off. Those aren't normal. That's your body not getting the nutrients it needs to make energy. And that is a continued stress on the body, which kind of perpetuates the whole cycle. So ways to combat that, obviously, are to address the stresses in the body. So sleeping more, addressing emotional stresses, things like that. But even on a simple scale is to encouraging people to eat more often, so therefore you're not going too long without food. And when you do this, your body can get more receptive to food and use it for energy better, which means you can burn fat better and you can make hormones better. It just kind of goes on from there. So simple scenario take home is to think about, you know what, when I eat, I feel like I gotta pass out or sleep or take a nap. Again, that's not normal. Or when I eat, I feel good, but between meals I get very, very sleepy, like in the afternoon, I crash, I need some caffeine, I need a candy bar or something. Those are both signs that the body is resistant to that blood sugar. It's not using sugar correctly for that energy. That should be a sign to you that it's not a diabetes problem or anything. It's that your stress mechanism, cortisol, in the adrenal glands is not working optimally. And I can tell you right now, we tell patients here, something as simple as that, blood sugar, can be the one thing that does not get you well in many aspects of health. Because this is all I'll talk about in the future, affects your gut, affects your brain, affects your skin, and even how you detoxify. So simple things, eating every few hours, getting your protein in the morning, getting your protein at night if you're not sleeping well. These can help balance your blood sugar, which is going to take tremendous, tremendous stress off your adrenal glands.